Hi everybody, I'm Aubree Adams. I just want to share a little story with you. I had something happen in my life the past few days that I want to share with you. Um, I am a former Colorado mom. I lived the nightmare of marijuana legalization in Pueblo, Colorado. It harmed my family, it harmed my community, and now I am an advocate for drug prevention and recovery. I oppose the legalization of marijuana because it's a drug promotional policy and it has allowed a predatory marijuana industry to target our children in the most vulnerable populations that we have. They lie about their products, they don't put harms and risks on their products, and they are not regulating their products. Their products are full of contaminants and they're full of THC, which is a neurotoxin that is causing psychosis and cannabinoid hyperemesis syndrome. And matter of fact, that vomiting syndrome, and most of you have probably not heard of that, that is caused by CBD also. So I will talk about that in another video. What I want to share with you is that my son experienced marijuana changed my son. It changed him, and what I witnessed with him changed me forever. So when the marijuana policies, promotional policies came to Colorado, my son was writing 420 on his clothes. They were already normalizing marijuana to him. His behavior started changing in the 8th grade. He was self-harming. At the time, we did not know, but he was using marijuana edibles from the industry that were in our school and at people's homes. And by his freshman year, it was February 2015, my son was irrational. He was paranoid and he was repeating things that did not make sense, and he was violent. And he was so violent towards his younger brother that his younger brother ran barefoot through the snow to get away from him. And that night my son tried to take his life. He was hospitalized, then discharged after 5 days. He did not improve. He was still irrational, paranoid, suicidal. I had him back in the ER within the next week. The psych liaison told me it was just marijuana and sent us home. He was not improving. I was not sleeping. I could not keep my eyes off of him. I was afraid he was going to take his life. I had him back in the ER within a few more days, and I was begging that psych liaison for help. He told me the reason why we were sent home is because there was no available beds in our community. But he did find a placement for my son in Colorado Springs, and my son spent another 5 days in a psychiatric unit. Upon discharge, my son told me he was dabbing marijuana, and he knew the dabs were making him feel crazy, and he was actually trying to quit. I had no clue what a dab was, and he explained to me, "Mom, dabs are crack weed. They're very strong marijuana," and I agree with him. I found out that dabs, this high potency THC, is mass produced and marketed in our community. It's called medicine. They take full page ads out in our newspaper, promoting it with cartoon characters. And my son's brain was addicted at that point, and I couldn't find treatment for his addiction. We were seeing a counselor for the psychiatric issues he was having, and I was realizing that marijuana was causing that, but it was minimized in our community. So my friend told me I could volunteer my family for crisis intervention with social service, so I did that, and we had a case open for 11 months. We had a therapist in our home working with the whole family, and my son did improve for a while, and then he started getting progressively worse, and we did everything. He went and lived with my parents for a while. We did everything we could to figure out and support him, hold him accountable, and then he tested positive for meth, and he was admitting he was using heroin. So he was put in a 90-day treatment program and put on meds and antipsychotics, and he did not really improve. He was kind of a walking zombie. He came home, we had a little bit of improvement, but then he started getting defiant again, and our case was closed. Social service told us that there was nothing else we could do at that point. They've done everything they could, and that was that. So my son just progressively got worse again. He said he was sober, but he relapsed, of course, and he picked marijuana to go to because he said it was the safer drug. Well, marijuana wrecks my son's brain, and he was running the streets, acting like he was homeless. I would find him begging for food and water in front of a gas station just a half mile away from my house, and it was rough. It was really, really rough to see your 16-year-old in that condition. And anyways, I had lost my job, and so I'm okay if the marijuana people lose their job during this crisis, this viral crisis. I'm totally okay with it because what they're selling out there is harming a lot of people. And I'm going to get to the story I'm going to tell you that happened in my life the past few days, this other public health crisis that we've been screaming about, that we've been trying to educate everybody about. But anyways, my son shows up after a few days of being on the streets, and I call the police, they can't help. Call social services, they can't help. And I had found a place in Utah to take him. And I took him to the ER. My son was skin and bones. He was vomiting a lot. The ER at that point did like an intervention with them and said, here, your mom found more treatment for you. You need to go. He agreed to go. He was very sick, just testing positive for marijuana. That's all that was in his system. And I took him home, and he was still very sick. He was vomiting 7-8 times a day. He was taking hot showers. And, I'll talk more about that syndrome later. He was never diagnosed with that syndrome, but this is just what happened. And everybody kept saying, no, that's heroin. Heroin does that. No, that's marijuana. Marijuana does that. And it's time that we bring awareness to this and bring the truth of the marijuana charade. Marijuana is toxic, period, and that includes the CBD part too. It is causing this syndrome, this vomiting syndrome. So my son agreed to go to that treatment center, but the night before we were supposed to leave, they called me and said I needed $36,000 or I couldn't bring him. Of course, I did not have that. I had lost my job through this whole process. Once my son started feeling better within a week and he realized I didn't have the money to take him to treatment, he was back out on the streets again. Showing back up like with the next week, I was at my wit's end. I did not know what to do with him. Police couldn't help. Social services said they couldn't help. They did everything they could. By the grace of God, I had started networking around the country and with other people that understood the harms of marijuana and understood what was happening. And I was put in contact with a young man who was a consultant for recovery, and he found a placement for him in San Diego, California. And that was a dual diagnosis treatment center. They understood the harms of marijuana. They waived my copays. They said, bring him as soon as you can. He qualified. They mentioned something about having a study with Harvard, so it was just luck. But that's where we started our true recovery, because they understood. They understood what was happening with my son's brain, how marijuana was breaking my son's brain. And they got him off everything, and he blossomed there. And they educated me, and they supported me, and it was a great place. I think I won't say it, but yeah, it was called Sovereign Health. And at that time, I was really involved with my community, and I found out. I decided I was not going to bring him back to a state that promotes marijuana use, that thinks marijuana is king and allows this industry to prey on the vulnerable population. So through my networking, I had found a place called in Houston, Texas, and I heard that they had a recovery high school there, and that they had alternative peer groups, and they had like just this whole recovery of community. So networking with Dr. Annette Edens over the phone, reading the book Monsters to Miracles, we prepared my son to come to Houston. and be part of this community. And so I knew I would not bring him back. So he came to Houston, and it was beautiful. I mean, he had his peers in recovery surrounding him. I had the parents surrounding me, supporting me, and he lived with host families, winning families that did their step work, that understood their part in the recovery process. And he lived with different host families for 2 years. One of his main host moms, I just want to say, has been very sick. We think she does have the coronavirus. And so if you could just say a little prayer for her. She's waiting for her test results, and the worst part is over. She is on the mend, but I was really worried about her. So we just need to give our love to her right now. I won't give out her name, but we'll just pray for everybody who's suffering with that right now. So anyways, there's more to my story, but I don't want to talk forever. But anyways, 1.5 years ago, my younger son and I moved to Houston, and we became part of the recovery community. And we're very blessed. And my younger son, who doesn't have a substance abuse problem, but has a lot of trauma from what he's been through, goes to a recovery high school, and he is blossoming there. He's doing wonderful, and he's learning to connect. He's learning accountability. He's learning he's not alone, and I'm learning that I'm not alone. And we have our sponsors, and we work our step work, and we I've hosted other kids in the program too a couple times, and it's just a whole community working together to drive. It's a parent-driven recovery is what it is, and I invite anybody to come learn about this model. I think it should be implemented throughout the United States. It's a whole continuum of care with a very dynamic system, with adventure learning programs and all kinds of stuff like that. So an IOP, but anyways, through my networking too with the marijuana issue, I had worked with many organizations, and 2 main organizations that I was working with. One was Parents Opposed to Pot, and the website is poppot.org. And the other one is Mom Strong, momstrong.org. Make sure you get the 2 S's in there. In Mom Strong, we tell our stories to unmask the marijuana charade. That's what I'm doing right now. And I want to continue to unmask the charade because I want to tell you, every day I get contacted by families that are struggling from the effects of marijuana, with their kids, with their loved ones, with their husbands, their wives, their parents, siblings. And I get contacted so much, sometimes I can't get back to people, and I try to give as much love and support as I can, and we work as a team to try to make sure that we're supporting everybody as best we can, and we try to publish their stories if they're willing, and protect their identity, and do everything we can to show that there are families that are losing their kids to marijuana. But through this networking, through Mom Strong, I was contacted by a family last August, and it was a mom who knew her son was homeless on the streets of Houston, and she was coming here, and she was asking me for resources and help. And we spent 3 or 4 days looking for her son. We did not find him. He has had multiple psychotic breaks from marijuana, and his first break was when he was 24, and they've been at this for 6 years now. So he had ended up leaving the state, and he found a place, and he got a little better. He got it was like a home. It wasn't like a state regulated home or anything like that, but he was a little better. He was having coherent conversations with his family, and stuff, so that's where he was. But last Thursday, I got a phone call from his mom, and she said, Aubree, she said, my son's back in Houston, and he's not good. He's really, really not well, and he's asking for help. She said, will you go get him and keep him safe until I can get there? I'm looking at air flights right now. And I said, of course I will. Of course I'll go get your son. So I had called him. He had a cell phone. And obviously I'm not supposed to be touching my face, but I'm touching my face, but I washed my hands. I went and I talked to him for an hour, and he really couldn't say like complete sentences. He just told me he's not doing good, and he agreed for me to come get him. He said he hadn't eaten or drank, and he didn't really. I said, well, I'll come and get you something to eat and drink, and he said he had money, but that just shows you he has money, but he's not taking care of himself. So I went and I got him, and it took a little bit. I just sat with him for a while. I visibly could see the psychosis. I don't have to be a doctor to see that. He was struggling, and I recognized it. I recognized it right away. My son was never diagnosed with psychosis, but what I witnessed with him, just my personal views, that it harmed him. So whatever it was, it changed him. It changed him to something he wasn't, and then that changed me forever. What I witnessed, what happened with my son, changed me forever, okay? And that's why I do what I do. And so I'm trying to convey that message to the rest of the country that we are having a public health crisis already, and then the virus is just, it's just awful to put on top of this. So anyways, I went and got my friend's son, and I brought him back to my apartment, and gave him some more food. Of course, we didn't leave the location without me giving him something to eat and drink, and he wanted help. So he agreed. He talked to his mom on the phone. They agreed to meet at my apartment, and that he would stay there till she got here. And that's what we did. I tried to give him some clean clothes and show him, see if he wanted to take a shower. I don't even think he knew how to process how to take one or what was going through his mind. But anyways, I watched this young man fight for his sanity until his mom showed up. Like I literally, like, he freaked. He tried to lay down. He couldn't sleep. And whether the manic psychosis. He could not sleep, and he tried, and then he would close his eyes and he'd scream out something was scaring him. And then he said he had to leave. He wanted to leave, and I just asked him. I said, "Can you just stay here until your mom gets here?" And if he was going to leave, I was going to call the police. But I saw him. He went to my backyard, and he just like meditated. He just tried to keep himself as stable as he possibly could. And I just kept eyes on him, and within a few hours, his mom was here. And when I saw the interaction between him and his mom, they hadn't seen each other in like a year and a half, 2 years. And he became animated, and it was his way of expressing his love for his mother. And they were on my back porch, and I was watching from afar. And, there's a special bond between a mother and a child, but a mother and a son, boy, I could just recognize that, because they're so lost in their disease, but that doesn't take away the love, it doesn't. So anyways, she knew that he was in psychosis, and she said, we got to get him to the hospital. And I was like, yes. And that agitated him. And he wanted help, but he didn't, and he started running, and we had to call the police, and the police were wonderful. They were absolutely wonderful, and they did everything they could, but they could not give the help to this young man that he needed, okay? Visibly, this young man could not make rational decisions or decisions that would take care of himself, okay? He was not in his right mind. Everybody could see it. You don't have to be a doctor to know that he was not in his right mind, that he was not safe. But unless he says he's going to harm himself or others, they cannot legally take him to the hospital. They can't force him to take him to the hospital. They tried to talk him into it. They did a lot of different techniques. They tried different avenues, and they were wonderful, absolutely wonderful. And then towards the end, we just thought if we could get him back in my apartment, then maybe we can try again in the morning. So, I mean, this was like 1:30, 2 o'clock in the morning. And so eventually the police did get him back into my apartment, and his mom was so exhausted. I mean, she was just so exhausted from traveling here, the scare of the virus, and, just wanting to get her son help. She said, I'm going to go to sleep. And I said, go to sleep, take my bed. I'm going to stay up, and I'm going to keep my eyes on him. And he tried. He laid down for a while. He tried to sleep. He couldn't sleep. And then finally, within a couple hours, he said, I need a walk. I need to go for a walk. And I said, please don't get lost. I knew I couldn't restrain him or anything. I asked him not to go, but he went. And he was gone for a couple hours. So then we called the police again. And another police officer showed up. He was absolutely wonderful. They must be giving great training to the officers in Harris County. I just want to say that. I was just so impressed. They were just remarkable. And pretty much this police officer had him convinced to going, and he agreed to go with his mom to the hospital, so the officer left. So in the meantime, his mom is trying to get him to get his shoes on and stuff and get him to the hospital. Well, finally they just leave, and her car was parked on the third floor of the apartment garage, and they left together. And next thing I know, she calls me. She says, call 911. He's trying to kill himself. He had ran up to the 4th floor and tried to jump off the building. So I'm calling 911, and I'm running up to that 4th floor, and I can hear her screaming. And I finally get up there, and she's got her body between him and the edge of the building, and she's got him pushed back, and it kind of, after a few minutes, and she's screaming, no, don't do this, and it kind of startled him, and he stopped pushing, and then he just started pacing. And I was just standing there on the phone with 911 explaining to them how to get there, and that we had a suicidal man that needed help. And I got myself between them and the edge of the building. And she had a family member on the phone who he was very connected with, talking to him, telling him to deep breathe, that help was coming, that he was going to be out of pain here soon, and that help was coming, and he just needed to maintain. And he kept pacing, but he wasn't trying to run towards the edge anymore. And the police showed up. They had a therapist with them. They were all wonderful, all wonderful. The therapist understood about marijuana-induced psychosis, or in the DMS-5, it's called cannabis-induced psychosis, CIP. She was very educated with it. She understood it. She understood that this was happening more and more. And just FYI, we don't know what his toxicology report is now. We just know what it was in the past when this happened to his brain. We don't even know if he was on any drugs at this point. The trauma of the virus scare could have triggered this in him, because his brain was already vulnerable, was already broken. So we don't know. And another thing that's wrong with our system, his mom, who's his #1 advocate, she probably will not be privileged to that information with this hospitalization, what drugs were in his system, if there was or wasn't. So we're not sure if we'll even know. And so he went without any resistance. And he told the therapist that the voices told him to jump because there was something bad going to happen. And I watched his mom save his life. That's what happened the past few days. Again. And so I'm doing this video for a number of reasons. One, to bring awareness to a public health crisis that hardly anybody's talking about, and in an issue that has a lot of misinformation legalizing marijuana made marijuana more dangerous, more accessible than ever. The old school black market marijuana was not this dangerous. It was causing psychosis previously, but not like it is now. It is more dangerous now. The legality of a drug, this is very important to understand, the legality of a drug does not take away the harms. It actually increases the harms. The number one drug that harms the most in our country and kills the most in our country is tobacco. The number two drug is alcohol. Are two legal drugs because they are legal. They kill the most because they are legal. If heroin was legal, it would kill the most, and we saw that with the opioid crisis, right? It was legal. People took advantage of it. There were parents like me speaking out about the opioid crisis, and people were ignoring them. And then Congress passed the Marino bill and made the opioid crisis just skyrocket, and those pill mills were opening up in the vulnerable communities, right? And it was getting everywhere, complete crisis. And now we have the marijuana industry preying upon our people, making up lies that it's helping the opioid crisis, which is not. The evidence shows it is not helping it, it's actually increasing it. Marijuana, the medical marijuana legalized states, the opioid overdoses have increased by 23%. That is science proven. The overdose deaths are not decreasing. So that's why I do what I do. I want to bring awareness to the harms of marijuana. I want people to oppose these policies. Legalization is a drug promotional policy. Alcohol is promoted, tobacco is promoted, and now they want to do it with marijuana and make it more dangerous than ever. And our medical system is already overloaded with the harms they are causing. And then these people that become psychotic from them aren't getting the services they need. So now we have the virus scare, we have the virus we're dealing with, and marijuana users are more susceptible to the virus. They have suppressed immune systems. They already have damage to their lungs, and this virus attacks the lungs. So we have put a lot of people at risk already from the harms of marijuana, and now with the virus, we've really put them at risk, and the marijuana industry has put them at risk. And they have propaganda out there. You wouldn't even believe what I was reading earlier. They have propaganda out there. They tell marijuana users that marijuana actually will help them recover from the virus. That's what they're telling them. That's how sick this is. And this is what predators they are. They're drug dealers in suits. They're just glorified drug dealers. So my point here is there's lots of families that want to tell their story. There's lots of families that want to give a voice. And this mom gave me permission to tell this story without divulging any personal information about them. And I'm grateful that she gave me this opportunity to tell you this. I'm grateful that she called me up to help her. And I just wish I could have helped more. I'm so glad her son is in the hospital right now. But I pray, I just work and I pray that he will get the long-term treatment that he deserves. And those are the costs. And that'll cost the taxpayers now. So anybody who thinks they want to legalize marijuana for tax money, you're not even counting the costs. And you're not counting the lives. And you tell me, this young man had a profession. He had a profession. He was college educated. Actually, he was an athlete. He was very well educated, and he was actually serving a population of underprivileged kids. And now, we lost him. And can we get him back? I hope and pray we can. But the suffering of the homeless on the streets is unbelievable. And if the virus hits them, oh my gosh, I can't even imagine. So marijuana is a causal factor for psychosis. Lancet Psychiatry, the gold standard, last year, their journal stated that low potency marijuana, 10% THC or lower, had a 3 to 5-fold increase for psychosis. High potency marijuana, which they labeled 10% or higher, had a 5 to 9-fold increase for marijuana. Now, just on, I think it was March 17th, their new journal this year, March 17th, 2020, listen to these conclusions. They did a meta-analysis. They looked at 15 studies with acute administration of THC, and then they looked at 4 studies for CBD. They came to the conclusion, and listen to this very closely, a single THC administration induces psychotic, negative, and other psychiatric symptoms with a large effect size, meaning they were able to look at those 15 studies and see that they had a lot of subjects to look at. Then the next sentence, there is no consistent evidence that CBD induces symptoms or moderates the effects of THC. So CBD is known to kind of counteract the effects of THC, so they're trying to prove that with looking at these studies. I know of other families whose kids have been in marijuana-induced psychosis, had tried to give them CBD to counteract the effects. It did not work. The CBD products that are on the market right now are not regulated. There's only one regulated product called Epidiolex, and it's FDA approved. I'll talk about CBD in another video, but my point is marijuana is a causal factor for psychosis, and it is a huge risk factor in our increase of homelessness, violence, suicides, addiction, and mental illness. And I'm Aubree Adams. I'm an advocate. I want to give a voice to the people that can't have a voice. And I want you to know we had a public health crisis on our hands before the virus came. And now that the virus is here, all those people are even at a higher risk. So I'm encouraging you all to share this video. Please share this video. Go to Parents Opposed to Pot and Mom Strong, like our pages and share our pages. If you need me to come talk to your communities, I'm happy to do that, do a presentation. I know professionals. I'm not a professional. I'm just an advocate. I'm an expert witness. I know what I witnessed, but I know professionals that'll come talk to your communities, and they are happy to provide this education because they witness the harms on a daily basis. Drug prevention is the best harm reduction. And may we all be safe and healthy, and may we all stop the promotion, the legalization of a predatory drug industry, the marijuana industry. And may we all quit creating families that mourn for their children that are still alive. And you see those children on the streets. Thank you.